So the palliative care service here in Cape Breton is comprised of healthcare professionals whose specialty it is to care for patients and their families who are faced with life-limiting illness. We work collaboratively with primary care practitioners, so family doctors and nurse practitioners, and other specialists in looking at the specific needs of patients who have unmet palliative care issues. We work with the groups that look after this in terms of their primary health care, but we're there to support them as they support their patients. So although we're a specialty service, we have a very close connection with the primary care network here. And what that means is that then hopefully patients can get quite seamless care along the trajectory of an illness. So if you take, for example, someone who's been diagnosed with an illness, it could be a cancer, it could be end-stage heart failure or kidney failure. Those patients, as they go through the illness, will have new things arise, new symptoms, new concerns, and need for decision-making or advanced care planning. We are in a position with our team of doctors, nurses, social workers, spiritual care provider. We have access to many other different disciplines who will work with us to address those unmet needs. And because of that, we're able to give holistic care. We look at the patient as being the most important person. We listen to the patient as the patient describes what they're going through. And that communication is so key for us to be sure that we're addressing the need that's causing the distress. Well, one thing I always like to think about is how palliative care grew up. And we've been very fortunate in this community because we have a long history with palliative care, over 30 years. And when we first began, one of the things that meant the most to us was the good work of Dame Cicely Saunders in the UK. And she had a quotation in her St. Christopher's Hospice. And we've spoken of this many times, both as a society and a palliative care service. You matter because you are you, and you matter until the end of your life. We will do all we can, not only to help you die peacefully, but also to live until you die. And I think that's the philosophy, and what gets us going to work every day is to try to make these days precious. And I feel if we can do that for one person, it has a ripple effect in the community, because people know that when they're facing these difficult times, there is a support network, not only of healthcare professionals, but of the Hospice Palliative Care Society of Cape Breton that's right there with us to meet these needs.